Hello everyone, in this module we are going to discuss gout. See, there are two gouts, acute gout and chronic gout. What is acute gout first? See, in the joint we are having uric acid, that's it. We are having uric acid in a joint. Now if we are having a foreign material, then we'll obviously have what? Inflammation, pain, right? So we are having arthritic joint pain and swelling, inflammation, all because the uric acid is a foreign material. So now let's see exactly how this inflammation and all is happening. See, first we have increased uric acid. Now this uric acid is deposited in the joints, and inside the joints we have what? Synovial fluid. But this uric acid is not soluble in synovial fluid. It is insoluble over here, so it will be precipitated in the joints, right? So why did uric acid enter joint? First, because there was increased uric acid and the permeability increased of this joint for the uric acid. So we have increased joint permeability. Now what will happen, as this uric acid over here is precipitated, these are the foreign materials, right? So there will be neutrophils that will be coming over here and it will be causing inflammation, and this inflammation is what? It's acute gout. Done. So now first this uric acid is precipitated. Now the synovial cell will engulf this uric acid, and this uric acid which is engulfed by synovial cell, they will release some glycoprotein, and the blood have neutrophils, right? So this glycoprotein is inviting the neutrophils over here to join the party. So this chemotaxis of neutrophils is caused by what? Glycoprotein, and these neutrophils are responsible for what? Causing the inflammation. So now we have neutrophils and it will cause all sorts of inflammation, joint destruction and pain. So this is acute gout. Now what is the most common site? The site is first metatarsal phalangeal joint. This one, right? Over here you can see, over here you can see, just memorize this image first. MP, metatarsal phalangeal joint. Now this was all about acute gout, where there was inflammation and acute condition. What is chronic gout? Chronic gout is simple, just two things: increased uric acid in blood, that's it. If your blood is having more uric acid, it is chronic gout. Done. This uric acid is not deposited in joints or bone anywhere, it is just inside your blood, so there is no pain and inflammation in this chronic gout condition. But what can happen is this uric acid, if it increases more or some, it can deposited in joint, so it can be deposited in joint which can worsen the attack. So chronic gout has a potential to cause what? Acute gout. So we have to treat this condition also. Right now chronic gout is not harmful, it is not causing any pain, it is not harming, but if this uric acid goes inside the joint, they will cause acute episodes of gout, right? So what should be the treatment? See, in acute gout, the neutrophil is causing havoc, right? Pain and inflammation. So we're going to decrease pain and inflammation in the acute gout. In chronic gout, we really don't have any problem. Uric acid is just there in blood, okay? So we just have to reduce that uric acid inside the blood so that it doesn't go in joint and cause what? Acute gout. Acute gout. Now what are the drugs for this? See, now before learning about the drugs in acute gout and chronic gout, you have to remember that why don't we decrease uric acid in acute gout? We know that in chronic gout there is increased uric acid. We will decrease this uric acid in chronic gout, but if there is, if we decrease uric acid in acute gout, then it can worsen the condition. How? Let's say you are having this uric acid inside the joint. This is what? This is acute gout, and you are also having uric acid inside the blood. Now if you try to reduce this uric acid, then when this uric acid is reduced, there is a gradient, right? These organs are also having uric acid. There is a gradient that uric acid is going to move from here to the blood vessels. So when they move in the blood vessel, some of them from these organs is deposited in these joints also. Why? Because there is increased permeability for the of the joints for uric acid. So in process of reaching the blood vessels in the body circulation, these are going to deposited inside the joint also, so the acute attack is worsened. So what we do is first treat this inflammation over here and then try to reduce uric acid in the blood. When will you reduce it? When the permeability is restored, when the joint is not permeable for uric acid, at that time you go and reduce uric acid in the acute gout, right? Done. So For now, treatment of acute gout. See, for treatment we know we have to reduce pain and inflammations, right? From here you will know that the membrane phospholipids are broken down into arachidonic acid, and this arachidonic acid in the sequence of pathways will make these prostaglandins and these leukotrienes, which are responsible for inflammation. Now I have to stop this process, right? So I need two drugs, so I will inhibit this enzyme. Let's say if I inhibit this enzyme, this is inhibited by steroids, so nothing is made, right? So there is absolutely no inflammation. The steroids are what? Anti-inflammatory. But if I inhibit an enzyme which is one down lower in step, then these guys are not made, but we still have leukotrienes which will cause inflammation. So NSAIDs are also anti-inflammatory because they will reduce some of this, but they're not as strong as steroids. Steroids are stronger. So in the treatment of acute gout, we give first NSAIDs and then we give steroids because steroids are used in extreme conditions. So drug of choice is NSAID here in acute gout and steroids. Let's say if it is not relieved by NSAIDs, then we give steroids, and if it's not relieved by steroid, then at last we give colchicine. This is the most effective drug. It will treat any kind of acute gout. Okay, name is colchicine. In chronic gout, what you have to just have to lower down the uric acid in the blood. Now, first we gave NSAIDs to the patient. The chronic episode of gout was not healed. Then we give steroids. Now, mind it, what these drugs are doing, it's a wonderful concept that these drugs, steroid and NSAIDs, are decreasing the substances that are responsible for inflammation, right? So there won't be inflammation. But we have a drug like colchicine. What colchicine does is it will inhibit this glycoprotein release, so no neutrophil is gonna come to your joint. So colchicine inhibits granulocyte migration, so neutrophils, if they won't come to the joint, then there will be absolutely no inflammation. So it is a higher step. These guys are doing what? These guys are reducing inflammatory mediators, so they are less efficient. Colchicine is the most efficient. Why? If no neutrophil is going to come to your joint, there won't be any inflammation, right? So we give drugs in this sequence: NSAID, steroids, and then colchicine. But if colchicine is that efficient, then why it is not the drug of choice? Because it has some side effect like diarrhea, myopathy. So it is not the drug of choice, but it's used at last after these two don't work. Done. Steroids are given intra-articular injections in the joints. Done. So let's see what are the other uses of colchicine. For this you have to remember this diagram. See, a thermometer is stuck in between lung and liver, and it is calling for help. So from calling we get colchicine, and thermometer is represented by fever or acute Mediterranean fever, for which colchicine is drug of choice. Liver cirrhosis and lung sarcoidosis. See, sarcoidosis is a condition affecting the lungs. You will learn this in medicine. So colchicine is used for the treatment of sarcoidosis, fever, and acute Mediterranean fever and cirrhosis. Three things. Done. Now, what is treatment of chronic gout? Chronic gout is simply, as I told you, there is blood vessel and there is increased uric acid. That's it, nothing else. It might cause some trophy in the skin, but this is the overview, right? Now, for treatment of chronic gout, you can do is decrease the production of uric acid, right? Increase its excretion, or increase the metabolism. So we'll study each of them. First, let's study about increasing the excretion. See, how will we increase the excretion? Let's say this is the uric acid. When this uric acid is filtered via, let me change the color, this is the uric acid. When it is filtered over here, sometimes it gets reabsorbed back, and this is going to take the uric acid to the blood, right? So we need to stop this reabsorption in order to excrete it. So we have drugs which will decrease reabsorption of uric acid. So this uric acid will not go inside the body, it will go take this path and will be excreted out. But we have a problem here. If this uric acid is excessively excreted from the kidney, it can get deposited in the kidney and they can cause kidney stone. So whenever you take this type of drugs which excretes uric acid, you are advised to take a lot of fluids, right? Take a lot of fluid, otherwise this stone are gonna cause This uric acid is going to cause stones inside the kidney. This is the most beautiful concept. We'll differentiate this from the uricose uric agent, right? Now, what are the drugs? See, just learn the diagram that uric acid is not going inside the body, it is going outside via urine. Why? Because here there is a pie, a car, and a sun. Three things are there in order to stop uric acid from going. So from pie we have probenecid, from Benz car, see this is a Benz Mercedes car, we have Benz bromeron, and from sun we have sulfenpyrazone. Done. So these three are gonna stop uric acid from here. Now, to in order for uric acid to go out by urine, we made a road to uric acid from here. So this road is Linus road. So we have four drugs which are uricose uric agent. So pi, Benzcar, sun, and a road. Done. Now this was about excreting the uric acid. Now we are decreasing the production of uric acid. How we are doing? Now let's see how uric acid is produced. Whenever there is a lot of cell breakdown or protein breakdown, we get xanthin from it, and this xanthin is becoming uric acid with the help of xanthin oxide. And this uric acid is insoluble, right? That's why it is excreted by kidney, and it can make stones in the kidney. Why? Because this is insoluble, and in humans this uric acid cannot be converted into any other form. Okay, this uric acid is the final product which is excreted by a kidney. So we can, if we inhibit this enzyme, then uric acid production decreases, right? So we have allopurinol and febuxostat. This allopurinol is the drug of choice for what? Chronic gout. So we have two drugs, allopurinol and febuxostat. Now what happened was, in birds, in humans this uric acid is the last product which will be excreted, but in birds we have an enzyme called uricase. So birds are having a uricase enzyme which is converting this uric acid to allantoin, and this allantoin is water soluble and it will be excreted in kidney. So what we did was, we took this enzyme from birds with all this DNA technology recombinant, and we made these two drugs. Those are raspbericase and peglodicase. So you have to imagine the bird, and inside the bird beaks there is a raspberry. So you have raspbericase and a peg here. So peglodicase. So you learn from this image. The bird is having raspbericase and peglodicase. This is what? These are converting uric acid to allantoin inside the human body. And why do we need that? Because this uric acid was insoluble in water, it was causing stones, right? So we need a water soluble form which does not cause stones in your kidney. So we are giving raspbericase and peglodicase. These three drugs are done. And why all this problem is causing? Because we have a lot of proteins which are making uric acid, right? So we give a advice to the patient of gout that eat less protein. Okay, done. So now we are studying one interaction of allopurinol. See, whenever we give anti-cancer drug like mercaptopurine or azathioprine, this xanthin oxidase enzyme is the one responsible to make this inactive. Otherwise, it will be toxic and all happening to our body. After the effect is done, this xanthin oxidase is going to make it inactive. Now, if you are taking these anti-cancer drugs, these guys, then they are also causing cell lysis, right? Which is their job, to reduce the tumor. So there is more xanthin and more uric acid, and this xanthin to uric acid is also happening with the help of this xanthin oxidase only. So what happened was, in our blood vessel there is more uric acid. Now we want to decrease this uric acid, right? After the all cancer lysis and syndromes, now I give allopurinol to this guy. Now I am giving allopurinol. Allopurinol is going to block this enzyme xanthin oxidase. So there will be decreased uric acid production, which is I want. But I want that this drug should also be inactive, right? Now this xanthin oxidase, when inhibited, these are not becoming inactive. So it's a problem for us. So whenever these drugs are given with allopurinol, you have to reduce the standard dose to 25%. Otherwise they won't be metabolized, as the enzyme is inactive which is causing their metabolism, right? So it will be increased in blood. Now allopurinol is given in chronic gout, okay, not acute gout, and anti-cancer drug in anti-cancer drug and as a kala asar. But don't give allopurinol in uric acid. Why? Because you can't reduce blood uric acid in the acute gout. Okay. Now if there is allergy to allopurinol, we can give febuxostat. Then the last topic of today is tumor lysis syndrome. See, what is tumor lysis syndrome? Whenever there is a tumor, if we give any chemotherapy or there is spontaneous breakdown of this cell, then a lot of protein will be released in blood, right? This protein will be converted into uric acid. So there is high uric acid in your blood. Now the problem is this: you are having high uric acid in blood. Now how will you solve this? Let's revise all the drugs. See, can I give here allopurinol? What will allopurinol do? Allopurinol will inhibit xanthine oxidase enzyme. So there is decreased production of uric acid from xanthine, but I already have a lot of uric acid over here. I don't want to inhibit the formation. I want to get rid of this. So I can't give allopurinol in tumor lysis syndrome, right? Done. Now next drugs. Next are uricose uric agent. What they will do? They will excrete this uric acid in kidney. But if there is a high uric acid inside the blood and I excrete all of this at a in kidney, then there will be renal stones in the kidney. I don't want this also, so I can't use uric acid, uricose uric agents also here. So what drugs I can use? I can use raspberry-case or pegloticase. What they will do? They will convert this uric acid in a water soluble form, allantoin, and this water soluble form will be excreted by the kidney without causing any stones. So these are what? These are the fastest urate lowering agents. They will work at a faster rate. But why? Because we didn't want kidney stones, so that's why we didn't give uricose uric agent. So in tumor lysis syndrome, what kind of drugs we are giving? Raspberry case and pegloticase. Done. So that was all for today.